Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Blood, Fainting, and Your Body's Hidden Trigger. And trust me, it's juicier than your cousin's peach cobbler. Let me ask you something. Why do some people faint at the sight of blood while others can watch surgery without flinching? I mean, we've all got that one friend who can watch the goriest horror movie while eating spaghetti, and another who hits the floor when they get a paper cut. Today, we're uncovering the surprising connection between your heart, your brain, and those sudden fainting spells that make you feel like you've been unplugged from the Matrix. So, what actually happens when you faint? Picture this. Your body has this internal drama queen called the vagus nerve. When it sees something it doesn't like, say blood or needles, it throws an absolute fit. This nerve triggers a dramatic drop in your heart rate and blood pressure. We're talking going from 0 to 0 in seconds. Blood flow to your brain suddenly decreases because your heart basically says, nope, I'm taking a break. Your body's protective response, make you lie down by any means necessary, even if that means face planting on the nearest available surface. This lovely phenomenon is called vasovagal syncope, and it's the most common type of fainting. Yep, entirely true. I can't make this stuff up. Now, here's where it gets interesting. Why does blood trigger this response in the first place? Your brain is like an overprotective parent at a playground. It perceives blood as a threat or trauma, even if you're just watching Grey's Anatomy. Stress hormones flood your system like Black Friday shoppers rushing the electronics section. The vagus nerve overreacts, essentially short-circuiting your heart rhythm like a faulty electrical panel. And here's the kicker, some people are genetically more sensitive to these triggers. Thanks, Mom and Dad. Let me share something from my practice. Vasovagal syncope affects 40% of people at least once in their lifetime. That's almost half of us. I had a patient, Sarah, who was training to be a nurse, smart as a whip, tough as nails, could handle anything life threw at her. But during her first blood draw training, she went down like a sack of potatoes. Her heart rate dropped from 70 beats per minute to 30 in seconds. She was convinced something was seriously wrong with her heart. Maybe she should find a new career. But here's the beautiful part. Once she understood the mechanism behind what was happening, she learned some simple prevention techniques and never fainted again. Knowledge is power, people. Let's talk about your heart's starring role in this fainting response. Your heart and nervous system are like an old married couple. They're constantly talking to each other, sometimes arguing, sometimes cooperating. When that vagus nerve gets really activated, it can actually stop your heart briefly. Not permanently, don't panic on me, but just long enough to make you feel like you're auditioning for a dramatic soap opera death scene. This explains why fainting feels so dramatic and scary. One second you're standing there minding your own business, the next you're waking up on the floor with people fanning you with whatever's handy. The good news? It's usually harmless and temporary. Your heart's just being theatrical. Now, if you're sitting there thinking, Doc, this sounds exactly like me, maybe I should see you in the clinic, we need to talk. But seriously, here's something you can use right now. If you're prone to fainting at the sight of blood, here's a trick that works 80% of the time. When you're exposed to your trigger, tense your leg muscles and cross your arms. I know it sounds simple, maybe too simple, but this technique can prevent up to 80% of fainting episodes by maintaining your blood pressure. It's like giving your circulatory system a pep talk when it wants to quit. Think of your body like a car with really sensitive brakes. Most of the time, everything runs smoothly, but hit the wrong button and suddenly you're stopped dead in your tracks. The key is learning to recognize your triggers and having tools ready when you need them. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.